Okay, we'll have the next one then by Dr. RISHI SWARUP, Optical Coherence Tomography in Recurrent Corneal Erosion Syndrome.
Can I get started? Yes. Good afternoon. This is a short presentation on the use of optical coherence tomography in recurrent corneal erosion syndrome, something I think all of us have seen in our clinic. That's what a typical RCE looks like on the slit lamp and when negative staining with fluorescein. As we know, this is a chronic relapsing disease of the cornea in which the patient wakes up with sudden pain and morning symptoms on waking up suddenly. And essentially, it's because the epithelium gets insufficiently attached due to dysfunctional hemidesmosomes, and they keep developing recurrent erosions in the epithelium. The most common cause is trauma followed by epithelial basement membrane, and of course, there's a host of other dystrophies and other conditions which can cause recurrent corneal erosions. It does present as a diagnostic dilemma sometimes for the ophthalmologists. I think history is something that gives it away often, but if the patient is coming in between episodes, the cornea can look completely normal. And that's why I think having tools like the anterior segment OCT may be useful in helping us diagnose this complex entity better. So the purpose of this study is to report the findings of OCT in patients with RCE. And the secondary objective was to study the etiology and also the effectiveness of excimer PTK. So this was a cross-sectional observational study done at one center, 46 eyes of 34 patients. We used the OptoView RTView OCT 17-line raster. And basically, patients were investigated and standard treatment was started based on their diagnosis. The scans were obtained at different stages of the pathology and studied for changes in different layers of the cornea, depending on when the patient presented and followed up. So this is what the results look like. The patients were predominantly female. 8 of these eyes had epithelial basement membrane dystrophy, which is 17%. And all these images were compared to a standard normal ASOCT, as is shown in the image on the right. So you can see 2 hyper-reflective lines. One is the tear film and one is the epithelial basement membrane. So the changes that we found in the OCT were predominantly epithelial changes, epithelial edema, irregular breaks in the epithelium, undetected epithelial basement membrane, intraepithelial basement membrane, intraepithelial inclusions. Epithelial basement membrane, Bowman membrane changes were the new finding in our study, which was thickening in 71%, hyperreflectivity in 88%, and slit-like spaces. These have not been described before. And stromal changes like anterior stromal hyperreflectivity. So these are the epithelial changes. In the first image, you can see intraepithelial basement membrane in the arrow, intraepithelial hyperreflective inclusion there. You can see irregular breaks in the epithelium in the image below, and you can see absent of epithelial basement membrane in that image over there. Basement membrane, Bowman membrane changes or like slit-like spaces. These were very commonly seen in our series, which indicates that probably the weak attachment at the hemidesmosomal level, and then hyperreflectivity and thickening of the BM-BM junction, as is shown in the image on the right. Anterior stromal hyperreflectivity, of course, is a known finding. 11 eyes of these underwent PTK with excellent results, and 10 of them completely resolved with PTK. So similar study has been done in the past with a 25-eye study, which is the largest study before this. And they have described the epithelial changes and the stromal changes, but the basement membrane, Bowman's membrane changes were the first time described in our study. So that's why I think this has some value. And of course, this should be studied in greater detail. If we can get higher resolution OCTs, we can do those as well. So to conclude, corneal OCT is useful to study the pathophysiology of recurrent corneal erosion syndrome and its evolution through various stages of the disease. It also helps in planning its management, especially when deciding depth and size of ablation during a PTK procedure. Thank you.
Thank you, Dr. Rishi. Any question? Okay.
Thank you.
Rishi, just one question was a very elegant study. I just wanted to know if the OCT features can give us any clue about which might recur, and because some do very well and some come back with recurrences. But do you think we can pick up any clue from the OCT? Can you tell us which might recur or which may not? Thing, because you just got one recurrence out of 11, so there's just one case. So
I'll have to go back and see what was different in that one case. But in general, most of them do quite well with either medical therapy or PTK.
Yeah, but yeah.
Yeah. So, I haven't really looked at that. Sorry.
Thank you.